Start by washing your hands, introducing yourself to the patient and gaining permission to perform the examination. Obtain adequate exposure. Then ask the patient to walk away a few steps, turn around and come back. With the patient standing, inspect from the front, the back and sides for any scars, swellings, asymmetry, deformities, erythema, sinuses and muscle wasting. Ensure the patient is not in any pain and feel for temperature changes with the back of your hand along the entire length of the spine. Palpate for pain whilst maintaining eye contact with the patient by systematically feeling the bones, then soft tissues, starting from the top of the cervical spine, running down to the sacroiliac joints. Run your fingers down the midline of the bony spine and feel for any stepping. Now test chest expansion. Ask the patient to breathe in, then fully out, and quickly place your thumbs on the patient parasternally with your index fingers in the line of the fifth intercostal spaces, and ask the patient to take a deep breath in. Normal expansion is 5 centimeters. This is grossly reduced in conditions such as ankylosing spondylitis. Now test the movements. Starting with the cervical spine, ask the patient to flex and extend, laterally flex, and rotate. Sitting the patient on the edge of a chair, ask the patient to place their arms on each hip and to twist to each side. Stand the patient up again and test the lumbar spine movements, starting with forward flexion, asking the patient to touch their toes. Ask the patient to bend backwards and to slide their hands down the sides of their legs to test lateral flexion. Now perform Schober's test. Draw a line through both dimples of Venus and mark the spine 5 centimeters below and 10 centimeters above this line. Keeping the tape measure in place, ask the patient to touch their toes and record the new distance between the outermost marks. Normal flexion is 5 centimeters, and this is reduced in lumbar spine pathology such as with ankylosing spondylitis. Ask the patient to lie on the examination couch. Now test for lumbar disc or sciatic nerve pathology. Starting with Braggard's test, perform a straight leg raise on the patient and stop if pain or paresthesia is precipitated. Now dorsiflex the foot, which will worsen symptoms if there is pathology. Following straight on from Braggard's test, perform Laseg's test, maintaining the angle of foot dorsiflexion, flexing the knee until the pain is relieved, and then further flexing the hip, which will worsen symptoms in a positive test. Now lie the patient prone. Ask the patient to flex their knee to 90 degrees and lift the ankle up, perpendicular to the couch. This is the reverse Laseg test or femoral stretch test. Repeat this on the other limb. Back or thigh pain suggests femoral nerve root compression. To finish your examination, you will need to perform Lermitter's sign, Beaver's sign, and abdominal reflex, check for associated lymphadenopathy, perform a full neurovascular examination. One can also perform Waddell's tests and ask whether the patient's symptoms affect their quality of life and sleep. Help the patient dress and order